In Competence by Design, your PGY year will still be used for your payroll contract, but your progress through residency will follow the stages of the competence continuum: transition to discipline, foundations, core, and transition to practice. The concept of stages was added to CBD in order to make the transitions more explicit. It's a big step to move from medical school to residency, from residency to a subspecialty, or from residency into practice. The transitions stages help emphasize the orientation and learning that happens as we make those changes in our professional identity. Stages also help delineate the progression of responsibility as you gain more knowledge and skills during residency. When I explain stages, I find the analogy of building a house can be helpful. Transition to discipline. In the house analogy, this is about getting the right base to start the build. This new stage helps residents settle into their program. Your program has been encouraged to take this time to help you get to know your co-residents and your supervisors, and to get familiar with how things work in your program and in the places you'll be working. It's also an opportunity for your program to get to know the knowledge and skills you bring to your residency from your previous medical training, whether that was in Canada or abroad. This stage helps set the groundwork for the rest of your residency. Use it to get comfortable in your new professional identity as a resident in that discipline. Foundations of discipline. This stage is meant to provide that solid underpinning that is the foundation of a successful residency. In most specialties, this includes getting some basic skills within the discipline and also having learning experiences in other services that will be helpful in your future. For example, anesthesiology residents in the foundation stage learn to provide anesthesia for patients and procedures that are not complex. This is work they will be doing throughout their professional career. They also have experiences on medical and surgical services where they learn how to assess and manage patients with a variety of underlying conditions and manage post-op care. This is not work they will be doing in their professional future, but it informs their abilities to provide anesthesia for patients with comorbidities and participate in the anesthesiologist's role relevant to perioperative care. For subspecialties, by the end of this stage, the resident is usually expected to be able to manage common or urgent problems within the discipline. While you are working in this stage, you probably won't be doing all the things a specialist or subspecialist does. Your program will select experiences that give you this foundational experience and will reserve some of the more specialized or complex aspects of the discipline for the next stage. In addition to clinical experiences, this stage may include formal teaching sessions or simulation training that prepares residents for the expectations of the core stage. Getting back to our house analogy, at the foundation stage, the house doesn't look very ready to live in, just like you might not feel very much like you are ready to grow out into practice. But the scaffold that this stage provides sets up that strong foundation for your career. Core of discipline. This stage is usually the longest, 9 to 15 months in a subspecialty and up to 3 years in a specialty. It includes the full breadth of clinical experiences in the discipline, and by the end of this stage, it is expected that you would be able to manage that full range of patients or cases. There's a lot to learn in this stage, and the degree of responsibility you are given for patient or case management will increase over time as your abilities improve. You will learn not only to do the right thing and do it right, and also the rationale and evidence base for those decisions. For specialties, the Royal College exam has been purposely placed near the end of this stage so that you consolidate your knowledge base. In many disciplines, this stage also has some flexibility, so you can pursue areas you are interested in or that are relevant to your further training or future practice. In our house analogy, things are looking pretty good by the end of the core stage. All the elements of a house are in place. It could be lived in, but the finishing touches haven't been put in place just yet. Similarly, you have experienced the breadth of your specialty or subspecialty, and you've become competent in a lot of the clinical work of the discipline, but you may not quite feel ready to set out on your own. Transition to practice. This stage is also new and was developed to respond to concerns that residents were not being fully prepared for independent practice. In our house analogy, this stage allows for the landscaping and finishing touches that make a house a home. For most specialties, the Royal College exam will be in the rearview mirror, and you can focus on applying all that studying you did to your clinical work. You'll be working in the junior attending role, taking responsibility not only for individual patients or cases, but also for other learners and how the service or day of clinic or procedures or readouts is run. Working in that role now, with your supervisor as backup, is intended to be a soft launch into your future practice. In addition to that senior role, there are things to learn about how to run a practice and other preparations for and expectations of your professional career. Your evolution to a fully independent practitioner won't stop with graduation from residency, but it's intended that this stage will ease that transition. Each stage in your residency has a distinct purpose. Knowing that focus can help you and your supervisors establish appropriate objectives for your learning and expectations of your performance.